Hi, everyone. My name is Christiana Morales. Welcome to SDP Connect. I am the Director of Self-Determination Program here. Uh, we had a very eventful week, so I missed the last Connect, and I just wanted to start by, I got so much love and so many well wishes from everybody in the community. It was just so heartwarming, and I wanted to thank all of you. It really touched my heart. We know that there are so many people who were impacted by the big fires, but we were just talking here that there are some popping up right now and right away. We know that there were a couple in San Diego. Judy said there was one here and that the Grapevine is closed here. So a lot is still going on with that. I do have an announcement for that. Let me share my screen really quickly. Um, San Gabriel Pomona, which was one of the areas that was really impacted, they are having a resource and recovery fair tomorrow, Thursday, and it's from 10 to 2. It's in person. We're going to have DVU is going to be there. So if you are around, please come stop by. If you are either somebody who needs support or services or somebody who provides them to other people, this is going to be a great place for you to go and get some resources. FEMA is going to be there. There's going to be all kinds of different support groups and transportation and all kinds of services there for you to get their information and get connected. So we hope that you will come and get that information. We did get a little bit of data from a couple of the regional centers last Friday. Their numbers, they said that San Gabriel Pomona Regional Center said that they had lost 13 group homes and that they had 144 of their clients have lost their homes. In West Side Regional Center, they said they had 70 families who had lost their homes, and then they had another 90 who were still not sure whether their homes were standing or not. They still were waiting to find out. So one of the things that happens, I think, at this is the emergency is over, but that's really where the work begins. And so we know that a lot of families are going to need a lot of support during this time. And so we are such a great tight-knit community, and I just know that everybody here is out there. If you need help, you need assistance, the regional centers did ask if you're a regional center client and you were in one of those evacuation areas to please contact your service coordinator if you haven't talked to them so they know that you're safe. They are trying to connect with everybody in those areas. And if you're not sure who your service coordinator is, you can call the main number and ask for the officer of the day. If you need services and you don't know who your service coordinator is, go ahead and call that main number, ask for the officer of the day, and they can help get you supports that you need. So I was gonna say Happy New Year, but it's kind of more like Happy New Year, like question mark. We're in the new year, but we have just arrived at 2025. So what we were supposed to talk about at our last Connect was postponed to this week. And so what we are going to talk about are all the exciting things that Disability Voices United is working on for self-determination program for this year. There's all kinds of new things that we're adding and changing, and we're really excited to share it with you. I have decided that this is the year of self-determination program. I'm just announcing it. So it is officially the year of self-determination program because Christiana decided. And I really hope that we can all pull together, that we can work as a community with our financial management services, with our independent facilitators, with our service coordinators to make this program work. We really want to see the program work better for everybody. And so that is our goal. And I'm willing it to happen. So we're going to make this happen. It's going to be great. So I'm going to start by sharing my screen, and we'll just kind of talk through what is going on. Judy, did you want to say hello before we get started?
I'm happy to. Hi, everybody. Judy Mark here, president of Disability Voices United. And I'm sorry my lighting's bad. I'm actually a political refugee today out of the country. I left the country because of bad things happening in our nation. And so we're doing really outreach to all of you. We know this has been a really rough 2025. This has been a very rough year between the fires in Southern California, the new administration taking over, and the threats of mass deportation and already we've already heard them firing all the diversity, equity, and inclusion staff in all of the federal departments. And of course, remember that diversity, equity, and inclusion also includes people with disabilities. And so we're really facing a lot this year. And so know that DVU is going to be leading efforts in any way we can and joining other groups' efforts to fight against cuts to Medicaid, which can actually impact our regional center services as well as our healthcare. And we are here to try to really improve the way people are able to live. I also just want to send our hearts or say that our hearts are with all of those affected by fires, not only those in the Eaton and Palisades fires, but also now the new fire, the Hughes fire in the Santa Clarita area. Please, everybody, stay safe out there, and we will all get through this together. Thanks.
Thanks, Judy. Okay, I'm going to share my screen and I'll talk to you about all the fun things that are going on with Disability Voices United this year. So we're going to have some changes, and they're going to be great changes, but I do want you to know we're going to put the links for the slides into the chat, so you'll be able to know what's going on as things are changing. I also want to highly recommend, if you are not on our email list, to get onto our email list. So you're going to get reminders of all these things, and you're going to find out what's going on with Disability Voices United, and we're going to put that link in the chat as well for you. So get on our email list and you'll get reminders of what's going on with us. So let's start about what's going to change here in the new year. Well, the first thing that we're rolling out, which I'm super excited about, is our new website. So our website is called SDP Resource Center. You can find it at sdpresourcecenter.org. We're going to put the link in the chat. It has everything from a step-by-step guide for people transitioning in. It's got financial management service, detailed lists, everything you wanted to know. It's got a statewide calendar. It's got a knowledge base, acronyms list. We really tried to put everything in there, and this is hopefully going to become your hub, your place to get accurate information. So I'm going to stop sharing my presentation for a second, and I am going to go to the website so we can give you a little sneak preview of what is on it. So let me share my screen again here. Okay, so here is our new SDP Resource Center. We have introduction to what self-determination is, because we have a lot of people who come and say, I don't even know what self-determination program is. We have little explainer videos, these little short 1 minute, 2 minute videos all throughout. So, and before I go much further, I want to talk about our amazing web designer. So we have an amazing web designer. She is a regional center client who has designed our whole website, but she also designed these explainer videos and all the characters from them. She is an amazing artist, and her name is Casey Robinson. She unfortunately was out of town this week, and so I had hoped to be able to introduce you all to her, but she will come hopefully next week. If not, we will do something in our email to introduce more about Casey. But this is her amazing artwork in it and all of her hard work. So yay, shout out to Casey. She's amazing. So on our website, here's the front page. We talk about the principles of self-determination, which is the core, the foundation of everything. We're going to talk about our meetups. So what DVU is offering for monthly meetups. I'm not going to go into detail right now because we're going to talk about them in a second of what each one is. But the idea is that we have live in-person meetings for people at every level. So people who are just trying to learn about self-determination program, don't know what it is, they get to come to the meeting and learn about stories from people who are in it and talking about it. We have a new program that's called Think Outside the Box, which I'll be talking to you about in just a few minutes, and our Connects, which you know about because you're here. So we have our Connect meeting recordings for you, so you can always find them. And we're going to scroll through the ideas that you can work your way through this site and should be able to as a participant. This is not intended to be independent facilitator training, or this is specifically for participants. So you guys have the knowledge, you have the know-how of what's going on in self-determination at every step of the way as you are transitioning into the program. So we have a section talking about what self-determination program is. Um, Down to some details. We have stories about what it is. We have our explainer videos. We do comparisons. What's the difference between the traditional system and the self-determination program? So there's just so much in here. I'm not going to walk you through every single piece of it, but I have a few highlights that I want to hit for you. One of them is, because I get so many questions about this, is how do I get started? And so this is you go to get started step by step, and it has a pathway that will walk you through every single piece of the process. Now, the idea of this is really to work in connection with our book. So if you are interested in purchasing our book, Think Outside the Box, you can purchase that through this website, through the bookstore, and it's sold through Amazon. And we'll also put the link in the chat for you, because the intent is that everything will work together. The website, our trainings, and the book to really help participants get all that information and knowledge that they need. In addition to the step-by-step guide, going through everything, we have Find an FMS. And this is the one that I think people have been asking for a lot. And this is a lot of detail about every single financial management service. And I ask them every single question I could think off the top of my head to ask them. This is going to be a living document. It's going to be changing all the time and updating as things change, because we know that things are constantly changing. So you can either search by your regional center for what financial management services are available to you through your regional center. You can search by all of them. So we're just going to go look at one. Let's look at we'll look at GT. And here is their page. It talks a little bit about who GT Financial is. It has their contact information. It has whether they have wait lists and what you need to do for their wait lists. It has what regional centers they work with, what languages they provide, how they have customer service. So they have a general call center. Others might have where you are assigned a person. You have one person who works with you. So these are all good things to know when you're trying to select your financial management service, so you can find the one that is going to work right for you. Um, we have I know this sounds a lot, but their vendor codes are on here because, believe it or not, some of the regional centers require their vendor code on your spending plan. So here's a great place to come find them if you don't know them. Um, we talk about their rates. So now, in this case, GT doesn't have an approved DDS rate. That's why it's written on here, so you know they will soon. They are working on it. It talks about what models they offer, what types of payments they do. And the other thing that we heard a lot from everybody was, we wish there was something like a Yelp for the financial management services. Well, Yelp actually has the financial management services. So at the bottom are the links. So you can find their Yelp reviews on each financial management service here. You can print these pages if you would like. So you can print each one out. But it should have so much information for you as you're trying to pick that financial management service for you. So that's a piece that we really thought was going to be helpful to everybody. The other thing we hear a lot is we use so many acronyms. We try not to as we're speaking. They kind of slip out and sneak in there all the time. And so if there's ever an acronym that we use and you don't know what it is, here's a great place to search and you can find them. So you can find she just said POS. What does that mean? It pops up here and it'll tell you that's purchase of service. So we have an acronym list here. Again, this is going to be something that grows and evolves and works as everybody needs it to. To be coming soon, which we'll be announcing in a second, is there will be a provider, another provider site. I'll talk about that in just a second. We also have a knowledge base, which is going to grow over time. Right now, it has all of the DDS directives, and it has information about each of the local volunteer advisory committees. So we can go look at here. We'll look at mine. Here's my local volunteer advisory committee. It talks about the date and time that they meet, who the committee members are, who the contacts are, how to find their web pages. So, and all the information. And believe it or not, I did not realize this, but every regional center also happened to have Yelp pages. And so you can get to the links for those as well. Our next piece is something I love, which is our statewide calendar. So the intent is to get onto our statewide calendar anything that's going on SDP related, that you can find it here. Now, we do know a calendar takes a lot of management, and we are going to do our very best to keep this up to date. We will be so we have a contact. So if something is not up to date or off, or you have something you want to add to it, reach out through our contact, let us know, and we will add it. So you can see here today we have SDP Connect. We have DVU has an independent facilitator roundtable. We have 3 LVACs tomorrow. So here's a great place if you want to know what's going on in self-determination statewide. You can click on here. See, even the master plan is showing up on here. So like I said, contact us if you have any questions, or there's something you wish that it was on here that you think is missing, or anything like that. So we would love for you to contact us. Also, at the bottom of this list, if you forget to do the email list on from today, you can always join it here. You can also go back to our Disability Voices main page by just clicking on the logo here, and it will take you back to our main page. So you can always get back to our DVU main site. And one last thing that I want to point out is we do not have funding for this website. We have asked the local volunteer advisory committees to help with funding for it. Some of them have been so generous and are doing that with us. But if this site is helping you, we encourage you to please use the donate button and donate any amount, even if it's $5 and you thought the site was just super helpful, is will really help us be able to continue to manage this site and host it and make it the best that we absolutely can. So I'm going to stop sharing now, and I'm going to go back to my screen to share what else we are up to. Okay, let me share again. Okay. So, as I kind of alluded to, Um, in we are also working on a second site, and it is going to be a provider site. The other thing we hear so much from people is that they want to know who are the providers in my area. Now, I want to be very clear about this, and I know that this, because having lists is something that drives Judy nuts. And so I want you to, and there's a reason for that, and I 100% agree with her. We want self-determination has to be based on your individualized needs, and your program shouldn't look like anybody else's. So we don't want anybody to think that you have to pick from this list or that you're limited to anything on this list. This is just ideas for you to maybe give you some inspiration, but we want to try to make your lives easier. So if there is a service locally that happens to already work with your financial management service and you're like, yeah, I'm going to use that, that's what this is here for. So use this as a means for inspiration. Don't limit yourself to this. Remember, we always want you to think outside that box. We want you as to do things that maybe somebody else had never even imagined. And I'm going to give you an example right now, which is super funny. My son, on his person-centered plan, he is 23 years old. He is in his 4th year self-determination program, had announced that he was watching a TV show called Forged in Fire, and they build swords. They are blacksmiths and they make swords. And he said, this is what I want to do for my social rec. I want to go, I want to become a blacksmith. And I said, Okay, let's figure this out. And believe it or not, we have blacksmith classes about 15 minutes away from us, and my son is going to do that. Now, my son, mom's a little concerned about the safety issue, so somebody's going to be going with him to make sure he's safe. But that's the kind of thing self-determination can provide for you. And I'm guarantee you it probably wouldn't have been on this list because it's very unique to him. So again, I just want to make sure. The other thing that's going to be on here are independent facilitators. And we know that it's difficult for people to find their independent facilitators. We know that that a lot of them have waiting lists and all that. So we are going to absolutely have lists and access for you to find local independent facilitators. So that will be coming very soon. We are hoping by spring. So, okay. So then let's talk about our meetings. So currently, we have SDP Connect on the second and fourth Wednesday of every month. And we're going to make a little adjustment here. What we've been hearing from some people who are newer people saying, we like SDP Connect, but it's a little advanced for us. I don't know enough about self-determination. I'm just trying to get into it. And you guys are giving us great information, but it's a little, you kind of have to already be in the program to understand what's going on. And we said, oh, we think you're right. So what we've decided to do is to split. So we have 3 levels of trainings here and meetings. The first is our I Get to Choose, hosted by our very own Tina Ewing Wilson. And this is on the first Friday of every month from 12 to 1. And this is our total introduction. This is for people who don't know anything about self-determination program and want to hear kind of stories of what is self-determination and what can we do with it. So it's uh, people sharing their programs and how it works and all of that. Our next level is called Think Outside the Box, just like our book. So this is an in-depth training. This is the one that's going to help you step by step go through the process of getting into the program. And so what we're going to do is I'm going to start sharing again. I'm going to show you the flyer for it. We are going to go through, think about the orientation. And a lot of people said, at the orientation, they walked away and they still had a lot of questions. And we realized, yeah, there's not enough time in that orientation. And at the very beginning, you don't always know what to ask because it's all so new and there's so much information. So what we're going to do is we're going to spend some time on each area. So we're going to start with our first one in February, where we're going to talk about your transition supports, finding your independent facilitator. How do you find one? What should you expect from them? All of those things. We're going to talk in March about person-centered planning. What is a person-centered plan? Why is this important? What should it look like? How do you find the right person to help you create your plan? What should be in it? All of those things. So we're going to answer all your questions. And every single one of these, we're going to make sure to have time at the end for tons of questions. And that's the intent, is we want to make sure that everybody has time to ask all of their questions. We're going to talk about budgets, probably more in depth than you even will ever want to go into. How do we know what traditional services are out there? How do we know what their rate should be? How do we know what can go in a budget? How do we know what can't go in a budget? So we're going to talk about all of those things. We're going to talk about the spending plan. What can go in a spending plan? How do I create one? How do I find the services? All of those pieces. We're going to talk about how you find the right financial management service for you. We're up to, I think, 22 now, and I know there are a couple new ones coming down the line. Um, and everyone is kind of unique and has their strengths and things. So we want to make sure that you find the one that's going to work really well with you. And so I see a lot on people asking questions of what's the best one. There isn't a best financial management service. There's the one that works right with you. So you want to find the one that's going to make your process smooth. And then the last one is on the transition. As you're finally transitioning and you're entering the program, what are the last things you need to do for that transition? And after we finish these, Judy and I have so many ideas of where we're going after this. We have so many trainings. We want to talk about so many people, employers, for the first time. They've never had employees before. So we're going to be doing trainings on that. We're going to be talking about once you're in the plan, in the program, what are the expectations of you and what should you be doing and working on? How much time is it going to be taking you or should it be taking you? Um, and so there's going to be so much more. So that's what this is really going to be about, is helping participants uh, get through this process, and we're going to make it smoother, easier, and make sure you have all the information you need. So, okay. So then let me go back to share my presentation here. And here we go. Here we go. And then our SDP Connect will continue. So SDP Connect will continue to be on the second Wednesday of every month. Our Think Outside the Box will be on the fourth Wednesday of every month. So we love our SDP Connect community, and so we will absolutely be continuing with our connects, getting the people to come out and speak to you and presenters and all of those things. And all three of them will be provided. We will be providing Spanish and Korean interpretation. Okay. The next thing we're going to do, because I told you we're going to be busy in 2025. This is why I'm saying this is the year of SDP. We're going to have our conference. Our SDP conference is going to be happening August 23rd, 2025. I know that people have been asking for if they want funding in their budget. So we will be putting out a flyer very soon for you, so you can have a save the date flyer so you can use that to get the budget. We do have a little bit of time since it's not until August. So it's going to be on Zoom. And we do want to mention, in our previous conferences, if you have come to one of our conferences in the past, um, we used to be registered or vendored with the regional center. So what happened was we moved our office where our mail went, and we're in a different regional center. And so we lost the vendor and all the courtesy vendors with that number. We had to recreate a vendor, and have decided that we are not going to do that. So we are not going to be vendoring with all of the regional centers. So that will mean that you will need to, if you're in self-determination program, plan on having it in your spending plan so you can have it covered. If you're with a regional center, we're going to go and be reaching out to the local volunteer advisory committees, see if they will help to make sure that people have, that maybe the LVACs will help pay for some people to go. Also, you can, if you're in the traditional system, that you can still ask for parent training or participant training. And or you can purchase it on your own to come. So we just want to give people a heads up so you have a little time to plan, because we know nothing in self-determination program happens fast. So it gives you some time to kind of plan for that. Okay. The other part that we do in self-determination program at Disability Voices United is we are working on community building. And this is really important because it feeds into our next section, which is our advocacy piece. And so some of the things that we do to build community is we work for the local volunteer advisory committees on some of their requests for proposals. And so we currently have a resource fair that we're going to be doing for Inland Regional Center in June. We do support groups for both Inland Regional Center and North LA Regional Center. And so we try to reach out into the community to provide assistance wherever we can. We also have a financial management service roundtable where we meet, DVU, Judy and I meet with the financial management services to really talk about what are the issues and concerns that they have that we can see if we can help get addressed. We are really hearing from them to see what can we do. But the other part that's really important is that we're making sure that the participants' voice and needs are being heard by the financial management service. So this is a really great place where it's a safe space where we can really share ideas and share concerns and figure out some things that are going on. We have a similar roundtable with local volunteer advisory committees. And this is a roundtable for anybody who is a local volunteer advisory committee member. So these are all kind of smaller closed meetings specifically for these groups. If you are part of a local volunteer advisory committee, you're a member and you would like to join it, you can reach out to Kaylee and at dvunited.org, and we're going to put her uh, info in the chat, and she will send you the information to join. I think at this point we have 18 out of the 21, somebody from 18 out of the 21 local volunteer advisory committees attending. So it's a great opportunity for the committees to kind of share how they're spending their money that they get to help for outreach, and also they're sharing their concerns and things that are going on with them so we can advocate. And the very last one is we also have an independent facilitator roundtable, so we can hear from our independent facilitators what's going on. They are really our frontline workers. They are our people right out there. And so they are able to share so much information with DVU of what they're experiencing out there. So those are all of our community building. If you have questions about any of those, or you're interested in attending any of those, if you happen to be a financial management service or you're part of a local volunteer advisory committee, you can reach out to Kaylee and she will send the information to you. Okay. So now I'm going to get a drink of water and turn it over to our president, Judy Mark.
Yes, that was a lot, Christiana. Great work, and we're so excited, everybody, to tell you about all the new wonderful things that our SDP team is doing this year. So as you know, we are the leading organization that advocates for breaking down the barriers to the self-determination program. We are the organization that was founded by the people who got the self-determination law passed. So if for those of you who are new, you may not know this, that last year DVU ran a bill in the legislature called Senate Bill 1281. And that bill really, we focused on the greatest barriers to the self-determination program. A lot of the things that you're seeing on the slide, like simplify and standardize enrollment and authorizations to get, requiring regional centers to do things in a timely manner for you. We are really working to ensure people have authority over their spending plans and over the way that they're living their lives. And so last year we ran this bill, and the bill passed unanimously in the state assembly and in the state senate. And then, unfortunately, in September, the governor vetoed the bill. But in his veto, and what that means, in case you don't know, is that he basically said this bill is not going forward because he has the authority as the governor to do that. So we were very disappointed, but he writes a letter when he vetoes a bill, and in his veto message, which is what it's called, he said, okay, these issues should be taken up in the master plan. And many of you know that there's a master plan for developmental services happening right now. Many of us have been part of the process. We've been going to meetings. I sit on the advisory committee along with several other folks from Disability Voices United. And so we have a set of recommendations that are going to be discussed actually in more detail next week. There's a meeting, hold on, I'm not exactly sure. Let me get you the exact date. I believe it's the 28th. Yes, Tuesday, the 28th of January, from 1 to 4 p.m., I believe. Maybe it's 12 to 3 p.m. Not sure based on the country I'm in. But it is next Tuesday, and we're going to be discussing the self-determination program a lot. And one of our major recommendations is that all of the elements that were in that bill should be part of the self-determination, should be part of policy. Now, all of the things that we put in this bill could be passed without a law. It could go into effect by what's called a directive from the Department of Developmental Services. And so we are going to spend a lot of our time meeting with DDS. Christiana and I meet with them every other week to talk about the self-determination program. But it, quite honestly, it's been very disappointing that um, that we have seen nothing. The bill was vetoed in September. There was a promise that things would start getting done, and nothing really has happened from DDS. They claim that that things we'll start seeing some improvements, but we haven't. So believe me, all the questions that you ask, all the concerns you bring to these SDP Connects, we bring those concerns directly to DDS. And so we are hopeful, just like Christiana said at the beginning, this is the year of the self-determination program. We are really, really hopeful that we will see some progress in the program. I mean, the other thing that I would say, which actually it came up at a meeting recently for the master plan, that right now, about 1% of people served by regional centers are part of the self-determination program. There's about 500,000 people served by regional centers and about less than 6,000 people in the self-determination program. Yet, if you look at the members of the master plan, both their full committees and the work groups, people in the self-determination program are profoundly overrepresented on these committees. And the reason why is because we are the activists and we know that the traditional system is really broken, that it is not working for people. And that's why the self-determination program, I believe, could be the savior of the entire developmental services system. And so we're going to really, really push the self-determination program, not only have its own little recommendations in one work group, but that it is infiltrating every concern that people have. If they say, we don't have access to generic resources, well, independent facilitators can do that. And we don't have access, or we need to have more choices and control of our lives. Well, self-determination program is really the only way. And we need person-centered services. There you go, back to the SDP. And so, so we believe even the areas of inequities, we know that there are a lot of racial and ethnic disparities in our system. And what we have seen in the self-determination program is that it resolves a lot of those disparities. Remember that no one in the self-determination program receives no services at all. Yet if you look at certain regional centers, up to 25 or 40% of people receive no services. So if you get into the self-determination program, you're getting services that work for you, as opposed to you having to fit in the little boxes of the services that the traditional system offers. So we're going to be there for you. We're going to be advocating. We're going to be coming back to this SDP Connect to get all of you involved when we need to. And hopefully those of you who can, please come to the master plan meeting on Tuesday. I'm hoping that maybe Eric or somebody on our staff can post the link to register for that meeting on Tuesday. Thanks.
So as you can see, we are planning on being very busy this year. I want to know that everybody, we do hear you. Like Judy said, we take everything, all the information that you guys are giving us, and we are working on it. And so we want everyone to know that our intent is that self-determination program should be easily accessible and easy to maintain. And I know that there are some people who are scarfing at this right now saying, like, no, it can be, and we can make it. And so I'll tell you that my son is in his 4th year, and we're kind of on cruise control right now. Now, I know with my son, it's always ups and downs. There's times when things are quiet, but that there's also times when things are going smoothly. And so for us, very fortunately right now, things are going smoothly. We're in a groove. So there is a learning curve to get with self-determination, but once you kind of get in that groove, it works very well. It does work. So um so now we have time to open up the floor, which we always like to do, to questions. So we can do both. You can either raise your hand to ask a question, or you can put your question in the chat and we will be able to answer them. And I usually alternate between the two. And these questions could be about anything. So anything that you have in mind, you can let us know. So, oh, look at this. We already have some hands up. Um, hey, Merzouk, go ahead and unmute.
Hi, it's Kim Razuk.
Hi, Kim.
I'm like literally, I was like a couple of exits away from the Eden Fire, so at the beginning I had to evacuate. But I'm also a private investigator out of another state, and I'm a missing persons advocate and I'm a disability rights advocate. And I just wanted to speak to, like just natural disasters or any type of events that we can't really, you know, kind of assume. But I wanted to say that there were three individuals. I mean, there were a lot of elderly individuals that succumbed to the fires as well, but there were two regional center clients that, perished in those fires, and one of them was, and then a third one, which was the caregiver of Elar's client. And it's really important to establish safety plans, and I think I spoke to like or like
Oh, Kim, I think we lost you. You're breaking up. We didn't hear the end part of what you said. I think we might have lost Kim, but I want to say, hopefully she can hear us 100%. And it's something that we were just talking about, of how important having emergency plans in your person-centered plan, talking about with your circle of support, who's going to be there, who's going to help you. It has brought it brought it very much to the forefront of our minds of um, uh, having a plan in place and why this is so important. So I think it is going to be much more it's going to be a big discussion in the next few months as we go on of how we're going to do that. Miriam, go ahead.
Hi.
Hello.
I heard that Mainsville sent a letter out today. I don't know if you've heard about that. Can you speak to that? It's about the minors being employers of record.
I actually haven't seen the letter yet. Oh, Judy's nodding. I think maybe she saw it.
Yeah, I saw it on the a Facebook post on the SDP Facebook page. Yeah, it's basically saying to anybody who has a minor child who's the employer of record that they have to switch it to one of the parents. And so I don't know, Christiana, if you want to talk a bit about the advocacy that we're doing around that, and that we're having a meeting about it next week.
So we have been meeting. So a little bit of background on it of kind of how this came up is that Mainsville said that they had gone ahead and applied to EDD. So when your financial management service, you hire an employee, they'll start, and when they get to, I don't quote me on the amount, I think it's $650, then they apply to EDD to get the California number. And what happened is when they applied to get this California number, out of the blue, they had never had a problem before. The EDD was saying, we can't give a number to a minor. And so we're like, what is going on here? So Judy, with her infinite connections, has gotten us together with the main decision makers, the people who really are going to be able to address this. And as she started explaining the situation to them, they stopped and said, no, no, we understand. We hear you. We talked about our concerns of why the minors need to be the employee of record, because these are their services. The services have to stay with them. So if a parent was an employer of record and something happened to that parent, all of their services would end because their employer went away. So it's really important that the minor is the employer of record in that case. So we are talking to them. We have a follow-up meeting with them next week. And so we are working very hard to get this resolved. So, we spoke to financial management services. We spoke to ones that work nationally. We spoke to other agencies, and they said, no, typically in other states, the minors are. So we're trying to get it straightened out. So hopefully we will have a better answer for you by our next Connect. But Miriam, thank you for bringing that up. I love Miriam. She's always on top of it. She keeps me going here. So does anybody else have any questions? You guys are quiet today. I think there are no questions. Oh, go ahead, Miriam.
Well, yeah, me again then. Do you have an update on the IF issue, Service Code 099 PDS? Have you talked to someone? Do you know of more regional centers? I heard that North LA is pretty close to having an FMS. San Diego yesterday said, or 2 days ago, they might be close, but I don't know of any others.
Those were the only two that I've heard of. But the good news is the ones that they were working with got their vendorship done, and so now they can courtesy. So hopefully we'll see it'll start spreading. Because I believe that and I know that there was another agency that was talking about doing it. So it's just getting them moving. Little annoyed by this because the regional centers had plenty of time to plan for this, and haven't. So it is definitely a concern for independent facilitators of how we're going to deal with it. Kim, go ahead.
I hope my connection is better. I was like coming through Dodger Stadium. Sorry.
Yeah, you sound much clearer now.
Yes, sorry. So I have an update too for that. There's a smaller FMS that is, I think it's Bay Area Fiduciary, and she applied for her vendorization of 099 and the courtesy through Golden Gate. So this has been a conversation, and I thank Miriam for like bringing this up, because I know that Leslie also in the group we're also emailing often, like weekly, multiple times a week, trying to get some clarity on this issue. So I appreciate it.
Oh, thanks for the information. This is why it's so great to be here, because we hear from people all over the state telling us what's going on. So that's very helpful. Thanks, Kim. Deborah, go ahead.
Okay, let's see if I can even show my face. I don't think I can. I'll start. I'll see if I can try. Oh gosh, look at me. I was in Sacramento this morning. Got out of my hotel room and drove home, and here I am. I'll lower my hand. Which was very interesting. I was at the State Council on Developmental Disabilities, their council meeting, and Aaron Christensen from DDS was there, and he was talking about the budget and the governor's budget and the federal government and how they're trying to push this particular legislation through to cut $1 trillion worth of money from Medicaid. And from what I was understanding, from like what I heard there, and I went to a webinar with ARC, is that the first services that are going to go are the home community-based programs, and that is SDP. And I asked the person, she was a speaker for the ARC. Her first name is Nicole. And I tried to get her to be a little bit more specific, because she kept saying, if this passes, there will be a huge impact. What's that impact? Finally, she said, there'll be no services. So that really made me not feel very good. And like, that's not what I wanted to hear. And then on the other hand, she kept saying, but it's not going to happen. It's not going to happen because we won't let it happen. Well, that's not what I heard in the meeting yesterday. The meeting I heard yesterday was that, yes, this could possibly happen. They're trying to push it through. Like every 7 days, they have to put in some file something every 7 days, and that by April, it's a done deal. And that the state of California is going to be okay because they're taking money from a lot of different places. However, they're not going to be able to expand services. They're not going to be able to hire anybody. They're not going to be able to probably the rate reform might be affected, et cetera, et cetera. So what they're saying is, yes, if it does happen, then I'm just concerned about people who are trying to enter the self-determination program because it's home community based versus traditional. And that is my question is, what is your guys' understanding in that situation if it were to happen?
Thanks, Deborah. So both the self-determination program and the traditional system are both called home and community-based services.
Oh,
Both.
they are. Okay, thank you. I didn't realize that.
So we don't know yet what the Trump administration is going to do. We only know what they say they're going to do.
Yeah.
And we only know what they tried to do the last time that he was in office.
That was in 2017, I believe, correct? And it didn't pass. It didn't go through.
So what the Trump administration is trying to do is not so much cut home and community-based services for people with developmental disabilities. What they're trying to do is to cut Medicaid, to cut the amount of money, not to get rid of Medicaid, but to cut the amount of money that Medicaid is spending.
Correct.
So Medicaid is much bigger than home and community-based services for people with IBD. It is basically health care for poor people.
Yeah.
And during the Obama administration, when they passed the Affordable Care Act, which gave every person in America an opportunity, every person who basically citizens and people with green cards, gave them opportunities to get access to health care. Remember, before Obamacare, before the Affordable Care Act, people did not have health care unless it was being provided by your employer or you could afford to pay for it privately.
Correct.
It's one of those people that was uninsured and had no health care. And I have a lot of health issues. So now people have access to health care.
Correct.
Access to health care is paid somewhat privately, but it is also paid through taxpayer dollars when the person is lower middle class or poor. And under the Obama administration, they expanded the opportunities for poor people to get access to health care. Then Trump went in and tried to shrink those numbers. And he failed at doing that. Mm-hmm. And the reason he failed is because even though people might have voted for him and supported for him, a lot of them were using the health care. And so there was just outrage at this concept of people getting their health care cut. Mm-hmm. And there were a lot of Republican governors and Republican states who realized, wow, we're getting all this federal money to ensure our citizens, our state residents. We don't want that federal money to go away. So that attempt to cut Medicaid failed. Now, then Biden came in, once again expanded it even more to give more people access to health care. Remember that home and community services is part of healthcare. And so what we know is for us to say, don't cut our home and community services, people will be like, what the heck's that? Instead, what we should be saying is don't cut our healthcare, because this is the way we are able to live. People with developmental disabilities are able to live in as opposed to being institutionalized.
Correct. Yep.
So what we know is that the Trump administration is coming back giving the same exact threats. And if any of you have read Project 2025, which is a group of very conservative folks wrote this sort of playbook on what they should be doing. And it's the only guide we have to think of what the Trump administration might be doing. is that they are not saying we want to cut services for people with disabilities. What they're saying is we want to cut the budget. And so therefore, we're going to have to pick and choose where the money goes. And so we think people with intellectual and developmental disabilities, they're the good guys. So they should continue to get their services. It's all those poor people that shouldn't get health care. And they're going to try to pit people with disabilities against poor people. And we're, at least at DVU, we're not going to allow that to happen. Because what we know is, who are those poor people? Those poor people are the siblings of people with IDD. They are the parents of people with IDD, and
The caregivers.
most definitely the staff, because
Yep.
we're making pretty low wages.
Yep.
So we can't allow we can't allow our community to get pushed into the corner to say, okay, if you're going to cut, don't cut us, cut them. Like, we're not going to say that. We're going to stay strong and just say Medicaid cannot be cut at all, because you have to protect our healthcare. And so we are joining together at DVU with other organizations like the State Council, like the unions. The unions are really very active, particularly the
Absolutely.
National Union. And so we're going to stand together. And so if folks are interested in becoming involved in this campaign, we will have more information going out on our mailing list. We'll have events, particularly in what is called purple districts. Purple means, so Democrats are blue, Republicans are red, in whoever came up with these colors 100 years ago. But when you put them together, they make purple. And so in these purple districts, where people are, where there's really very close races between a Democrat and a Republican for Congress, sometimes it's a Republican member and sometimes it's a Democratic member. That is where we're focusing. There are about 8 or 9 purple districts in the state of California. They're in Orange County, in San Bernardino County, in northern LA County, and in parts of the Central Valley. Bakersfield, and in areas that are really sparsely populated in the center of the state. And that is where we are focusing our efforts, is going to these members' offices, talking to them, saying, you cannot cut our health care. So everybody, if any of you live in these districts, please stay tuned, because we are really going to be focusing on you to bring constituents to these members to say, if you don't support us, it's going to be a problem when you try to run for re-election.
Exactly. Well, thank you. You really explained that so well, because it wasn't explained to me that way. And I really try not to get anxiety about something that hasn't happened yet. I'm still eating the popcorn, watching the movie. And so I just wanted to have some clarity on that. And you did a terrific job. So thank you so much for answering that question.
If other folks have questions, it can be really basic questions about the self-determination program, or, you're not sure. I mean, there's 80 of you here, so you're here for a reason. So please, you can ask questions in the chat, or you can raise your hand. Okay, there's Lisa. Hi, Lisa.
Hi, I have a question. I know that on spending plans, if we want to move more than 10%, so it's a two-part question. If we want to move more than 10% from one category to another category, we have to go back to regional center and get a new spending plan approved. So my question on that is that 10%. So let's just pretend to make this easy. I want to move funds from 331 to 371, and it can't be more than 10% without going to regional center. Is that 10% of what 371 was before the move, or 331 was before the move? Like, where does that 10% come from? Like, if I get my calculator out, what numbers do I put in?
I'm going to tell you, there is a problem with that 10% without notifying your regional center. If you're moving between service codes currently, You're going to have to notify your regional center because they have to close the purchase of service for each one of those and reopen them as you move services. So even though you can move the 10%, you have to let them know because they need so each service code currently has its own purchase of service. Think of it like a line of credit, right?
Well,
And so we can't just move money between them without changing those purchase of service, or the financial management service won't have access to it. So what it technically means is you can move that money without the regional center hemming and hawing or needing to approval or those kind of things, but they still need to change those POSs, the purchase of services.
I think
So
my FMS goes and asks them to fix it themselves then, because I've done it before in the past and I didn't contact my regional center, and the FMS, I did it a couple of times over the last 4 years. But do you know what the 10% comes from? I mean, I hear what you're saying, and I think like for me, my FMS gets the POS fixed because I haven't been involved, but I don't know what the 10% comes from.
we've gone back and forth, Judy. Is it the 10% of the overall budget or the 10% of that service category?
No, 10% of the overall budget.
Okay, that answered my question. And then this.
So that helps you, right? Because it's so it's that 10%, it was written into the law. And let me explain, because people think it's such a random thing, but let me explain to you why we put that in the law. So the 3 budget categories, by the way, you know, there's nothing in the law that requires us to put things into service code numbers. And so one of the things we did with SB 1281 is to clarify that you do not need to put service codes in your spending plan. This is something that I don't know how it happened, but the regional centers were making it and forcing us to do. But the 3 service codes, the 3 categories are living arrangements. So that's things like supported living services, people to support you in your own home. It could be housekeeping services. So anything that allows you to live in a place and support you to live in the community, right? The second category is employment and community participation. And so obviously employment is obvious, but community participation is like almost everything else. It's like all those social rec fun things you like to do. It's having a driver take you to your church or synagogue. It's taking dancing lessons, you know, whatever you want to do that helps you be a civic participant in the community, that goes into that budget category. The third budget category is health and safety. So those are things like nursing services or durable medical equipment, or any kind of specialized support related to your health, or it might even be putting up like safety cameras in your house or something along those lines. They are really different things. And the reason why we have 3 budget categories is you can't have the regional center commit to say, okay, this is the way you're going to spend your money, that you're going to be living outside your home and you're getting all this money in supported living type services. And then you decide, nah, I don't want to do that anymore. I'm going to live back with my parents and I'm going to take all that money for supported living and put it into community participation. There needs to be a conversation about that. Another good example is, let's say you get really, really sick and you need to get nursing services. And so maybe the regional center puts more money into the budget to give you nursing services, but then you get better. You can't take all that money for nursing services and put it into community participation without having a conversation with the regional center, because they're very different things. So that's why there are 3 budget categories. But what you shouldn't have to do is to say, I've decided I'm going to take a karate class instead of taking a swimming class. I shouldn't have to jump through hoops to do something as little as that.
So that's actually leading me to my part 2 question, the second part of my question, which is I was able to find where that 10% comes from, right, in the law. And it's also on the DDS web page under their FAQs. I have an FMS, not my FMS, for those who know where I'm at, not my FMS, but I have an FMS that is telling a client they cannot move money from music to dance, right, on their spending plan. without getting a spending plan approval from regional centers. So I was trying to find this person where it says that or close enough so she can have an argument with her FMS to try to prevent the months-long process of having your kid do more music and less dance or whatever it was. And I understand the 3 categories, but in this case, both are 331 on her spending plan. So that I was trying to find out where it says that.
It doesn't. It doesn't say it anywhere. It doesn't say it in the law. It doesn't require it in directives. There is no rule requiring this. Let me tell you why they do it. It's because the FMSs are scared they're not going to get paid by the regional center. So the reason why they're saying you got to go back to your regional center and say it's okay is because in the first couple of years when this program was rolled out, they would spend money assuming it was fine. And then the regional center would say, hey, we didn't want you to spend it on that. And then the FMSs didn't get paid back and the FMSs got screwed. And so they are now very scared. And so that's how come a lot of people are calling them like mini regional centers, because they're saying it's that same culture of no that's in the traditional system is like we're getting the culture of no in the SDP. And so one of the things we had in our bill of SB 1281 was making it very clear that that is not required. And to say once the spending plan is sent to the FMS can just pay it. So we're trying to fix that, believe me.
And it's very different between financial management services and regional centers. So we'll have an FMS that won't have a problem with it, but one of the regional centers will. And so they're kind of just going down to the lowest common denominator, which is part of what it's making it more and more difficult. So we had a question in chat from Natalie at 5:30. And she said, you're going to love this one, Judy. Are we getting any closer to getting SDP moved out from under regional centers?
Oh, God, no. We are nowhere close on that one. I can tell you that in the master plan, we had that as one of the suggested ideas, and it was like resoundingly rejected by many people. I could not get movement on it, and so I just dropped it. It's certainly a dream to have a different we ran a bill that went nowhere. We couldn't even find someone to author it in the legislature a few years ago that tried to create what we called a co-op or a cooperative for self-determination, which was not another regional center, but it had the ability to fund services through the SDP, and that it was totally controlled by SDP participants and their families. And everybody voted on the board, and the board was, all understood the self-determination program, and everyone who worked there understood the self-determination program. And we went nowhere with that. So obviously that's a dream. I think it's a dream that may not come true ever, but it is something that we continue to try to throw out there. It's not going to happen anytime soon.
Sandra, go ahead.
Gracias. Esta pregunta, si la persona que hace la traducción me ayuda. Tengo un niño de 5 años al cual le negaron en el centro regional apoyos de asistente personal. Solo le dieron horas de respiro que dicen que por ser menor de edad es responsabilidad de los papás el cuidado total del niño. Él es un niño que presenta siempre peligros para él mismo porque se lanza de las cosas, toma las cosas de la cocina, todo esto. ¿Qué me pueden ustedes apoyar para poder justificar el hecho de que sí necesita asistente personal?
So one of the things that I think personal assistant is one that is really difficult across different regional centers because different regional centers call these services different things and different ones offer it or don't offer it. So one of the mistakes that can be made is if you go and you ask for a specific service like personal assistant and they'll deny it, what you have to do is, like you just did, explain what the behavior is, what you need, and say, what service can you give me to help with this? So it may not be at your regional center. They might have a purchase of service standard where they don't have personal. I don't know what regional center you're with. Some of them do, and some of them don't offer personal assistance. Some of them will stick by the minor, parental rules, but you need to talk to them about what his individual need is and what support that he is going to need, because it may be called something different. It may be something different, but he still needs that support. That is an unmet need. So I think that would be a good way to go in. And so they say, okay, if you can't do personal assistant, what are you going to give us? These are the behaviors we're having. These are the situations that we're having. So I would talk about it. You said he was a minor. I would ask about adaptive skills. I would ask about behavioral. There are other options that could be out there. So I think that could be a way to go about it.
But I want to make a comment about people, children who are only getting respite, and it doesn't seem like it's worth it to get in the SDP. I still think it's worth it, even if all you're getting is like 30 hours or 50 hours a month of respite. Because at least what you can do is spend that money in the way you want to spend that money, right? You certainly should be getting social rec, Sandra. Like, for sure, your child should be getting some sort of social rec funding. And so that adds to the budget a little bit more. And even if it's not very much, like even if you only have $25,000 in your budget, $25,000 spending it the way you want to spend it is way better than being forced to pay minimum wage to somebody through a respite agency. So I encourage people that, don't wait to get in the SDP. Go into it even if you have a small budget, and then you can try to argue through a fair hearing process to get more services.
Mary at 531 said, my regional center told me that GT Independence will no longer have the co-employer model. I unfortunately have not heard back from them. Do you guys happen to know? Actually, I just spoke to them. They said they do not have plans to eliminate the co-employer, but they are not currently taking any new co-employer. So we will keep you updated if we hear anything different, but that's what GT told us just recently. Vi at 537 said, sorry, this is small, but it's from our case manager saying the 10% is from the budget category you're moving money from, not the full budget amount. Can anyone direct to where DDS says the full 10% is based on the full budget? That is a good question. It's probably can find it in the law.
I could be wrong. I have been known to be wrong. I thought it was 10% of the full budget, but it may just be 10% of the category. What do you know, Christiana?
I had to ask you because I could not remember.
I'm trying to look closely at this Vi. What is this? What was this from again?
I actually think
I think you might be right. If this is like from the law, hold on. I'm not at home and I can't actually get on the DDS website right now. Apparently, if you're out of the country, you cannot get on the DDS or any state government website. But you may be right. So forget what I said. It's 10% of the budget category. Sorry about that, Lisa.
okay. Okay.
Yeah, it's advising it's from DDS, but didn't provide just a screenshot. Like, folks never accept like a screenshot of something as reliable. Like, tell me it should be in law or in policy. So law is the actual self-determination law, which you can, is there a link to it on our new SDP Resource Center? Okay, there you go. Or it might be in a directive. And I can promise you all of the directives are on the new SDP Resource Center website. So, so definitely check that out.
Amy put in the FAQ in the chat, and it says 10% of the funds originally distributed to any budget category to another budget category.
Oh, it is. I was wrong.
Well,
And
and
I
I
feel like I've
think
gotten this wrong before.
I
Oh.
think that it makes sense because Judy made the really good point. If you're moving more than 10% from one of those main categories to another, something in your life has probably changed, and they want to have a sit down and talk about what's going on, I think was really the intent.
That makes sense.
it. Yeah. So
All
that
right. Sorry, people. Hopefully people continue to watch this video afterwards. When I'm-
Any other questions? Let's see. You guys are so quiet today.
trying to think of other things I can tell people. Well, we could certainly look at at what's going to happen at the master plan next week. There's 3 meetings, I think 2 or 3. Hold on, let me look at my calendar. I believe there's 3 meetings next week. I know on Monday Monday there's none. Tuesday there's work group 1, which is going to be talking about the self-determination program. On Wednesday is work group 4. Definitely go to that one as well. That's going to be talking about accountability and oversight. And then that may be all of them.
Oh,
No,
and
work group 3.
Friday is work group 3.
Yeah, which is talking about staffing. But we need to hear from all of you. I know that it's like a pain in the butt to sit through a 3-hour meeting, and public comment is in the last half hour. But all of you, if you come on and you say, God, the self-determination program is life-changing, but you need to break down the barriers, this should be the highest priority of the master plan, that could be really, really helpful to us.
I thought it might be interesting too, Judy, to talk a little bit about all of the changes in leadership that have happened in the last year, all the way from HHS through to of kind of why Christie's so positive about SDP right now is
Yeah.
that I feel like there's change in the air.
Yeah, I mean, you mean leadership at DDS or leadership?
Yeah. So
So
Dr. Galley and all the way down. So
almost everything's changed in the state except for the governor. The governor's still there, and he cannot run again. So there will be a state election next year, and there are a gazillion people running for governor right now already, and it's more than a year away. Actually really amazing people are running for governor, so we're very lucky. I think we'd be good if any of them were elected, but but we have a new Secretary of Health and Human Services named Kim Johnson, who is, at least from the limited knowledge I have, I met with her once for about 30 minutes. She seems incredible. She's an advocate before going into the state government, and I think really understands that DDS needs to be providing better oversight. We also have a new DDS director. As of I think sometime in December, Pete Chervinka was formally appointed as the DDS director. And there's other sort of changes in leadership even within DDS. I think there needs to be more changes at DDS. I'm hoping that there will be a real culture shift with this change. At the same time, there's all these new leaders in the state legislature. Our champion last year was an amazing senator named Caroline Menjivar. She was the chair of a very important budget subcommittee that did oversight of DDS. She is staying on that committee, but she's no longer the chair. And we have a new chair, and I'm blanking on his name. Sorry about that, everybody. But he's new, and that new chair is actually Akila Weber. Sorry, Akila Weber's from the San Diego area, and Senator Menjivar is now going to be chair of the Health Committee. We also have a new chair of the Human Services Committee. So basically everything, all the issues that we care about are going to be under pretty new leadership. And so they're going to require a lot of educating, and we're going to have to tell them about what is the developmental services system. and what is the self-determination program. So hopefully you all can get involved in I can tell you that they've announced there's going to be a big hearing in the Capitol, in the state Senate. I believe it's on April 28th. So they've announced that date for sure. I got an email about it and I'm just checking on it. No, that doesn't sound right. It's not going to be on a Monday. Might be like April. Yeah, it's April 24th. Sorry, it's Thursday, April 24th. And the Assembly Budget Committee has not set their dates yet, but it's gonna be late. Usually they're like end of February, and it's gonna be late because of the master plan. So everything's hinging on this master plan.
And then I don't know if you want to talk about the governor's budget that came out. And what does that mean with things going on federally? So he came out with his budget. I'm not going to remember off the top of my head. It was an increase in how many participants they expected to be in regional center clients, right? Was it consumers?
Yeah, so it's the governor presented his budget on January 10th. And in it, it's the whole budget. It's everything, transportation, healthcare, prisons, everything's in this budget. There's a special budget specifically for DDS, and they made some assumptions, and I don't have it in front of me, but it's a bit over 500,000 consumers they're expecting, which is like a 50,000 person increase. And the budget that they're requesting is $19 billion. Like a $3 billion increase. And the reason why it's such an increase is because of those rate increases that the service providers are getting. And actually, now that we're talking about rate increases, I'm wondering, Christiana, if we might want to spend a few minutes to talk about the fact that rates were increased as of January 1st. So everybody, the final set of rate increases for service providers in the traditional system happened on January 1st. So if any of you need more money in your budgets, you can go back to your regional center and say, I want to increase my budget based on the increases in the traditional system. So let's say, like, I'll use an example of my son. So my son is getting some supported living services. This is to make up his budget. Supporting living services, independent living services, some personal assistance hours, and some social wrap. And I don't remember what. And my son does not live with us anymore. He moved out last year, which is so great. And so, but the way that they determine this budget, because it was we're at June 1st is our rollover date. That means that we could substantially increase our budget based on the new rates that came up in January 1st. I'll just tell you what we're doing is right now, we're not actually asking for an increase. We're monitoring our monthly reports that we get. And if we see that we are actually going to need an increase in our budget, we will then go at some point in the next couple of months. We have until June 1st. So we're sort of monitoring things. If we don't end up needing that increase, we're not going to ask for it. That's the responsibility piece of the self-determination program. And I've said this before, like if you're coming to the end of your budget year and you haven't spent all your money, that means you didn't need the money. You didn't need those services. And don't go like on a spending spree in your last month. Like that's not responsible. Okay. This is not Price is Right. This is not a game show. This is government funds. And so what we're going to do is just see, if we need this funding, we'll ask for it. We may not even ask for all that we're entitled to. But as we roll over to our next year, I would like to see, like, what would our budget be with these new rates? Because it's very possible we're going to want to give salary increases to our staff or something like that. So that's just my suggestion. I don't know if Christiana, you want to add to that.
So the regional centers have kind of said exactly what you said, which is if you don't need it, don't go through a budget meeting and a spending plan change mid-year because they are all so backed up. And so if it is an emergency and you need it, then they said to reach out then. Otherwise, they would address it at your annual rollover. Now, different regional centers are dealing with it differently at that rollover. Some of them will automatically give you that up to that 90% base rate. So the way it worked with the rate adjustments was they had multiple adjustments. They didn't give everybody an adjustment at once, so they broke it up. And they got to the point where they had the 90% of what the rate was going to be. And then the last 10% was based on a quality incentive program. And that meant that they had to go and the vendors had to go and sign up for something in order to get this. The problem we're having is getting a straight answer out of DDS of, do people in self-determination program get that final 10%? Is that the rate, or is the 90% the base rate? And we're getting different answers from different regional centers. So you may get a different answer from your regional center. We believe it should be the full amount. And that's what DVU is advocating for. And we're trying to get DDS to come out with a directive to clarify that. So remember, these are traditional system rates. And so they kind of hadn't planned on how it was going to impact self-determination programs. So that's why we're doing a little catch up right now, is so they have to figure out how they're going to do it.
So let me add to that. So let me tell you why we're advocating that it needs to be the 100% rate, because we don't get to have any incentives to get that 10%. Like, that's patently unfair. So let's say, so I can tell you, if you're in the traditional system and you're using a supported living services provider, they get 90% of the rate. But all that that provider had to do to get the extra 10% is to fill out a form that DDS sent them to get in this provider directory. That's literally all they had to do to get an extra 10%. And to some service providers, that could be in the millions of dollars more for filling out a freaking form. So we don't get to fill out that form. So why is it that why would we get penalized by only getting 90% when we don't even have access to any kind of quality incentive? So I am really, really confident that DDS agrees with us on this. And so if anybody's having any problems in this area and the regional center is telling them 90%, I beg you to go to fair hearing over this. And I think you will definitely win.
And also let the ombudsperson's office know, because they need to get data to DDS to know that it is occurring. So if anybody is given a hard time about these rate increases, do let the ombudsperson's office know. So we are just about out of time. I want to thank our interpreters. They are always amazing. We love you, and we appreciate you so much. Judy, go and have a wonderful time. We want you to come home soon. We miss you.
I never want to come home.
I was worried about you just going, yeah, I'm not coming back. It sounds very beautiful where you're at.
I'm in Mexico. Let's see if they let me in.
I want everybody to have a wonderful week. Remember that, oh, and I do want everybody to know, so next time we are going to have a new link for our SDP Connect. We'll have a fresh link for the year. It is going to be put in the chat. Eric will put it in the chat as a reminder. If you are on our email list, you will get it through the email. You can go to our website and click on it there. It will be there. So just a reminder that next time on that second Wednesday for our Connect, we're going to have a new link. And we'll make sure to get it out there to everybody so you can find it.
And of course, it's going to be very confusing because this link is actually called the new link that you're using now, because we had a previous link like 5 years ago. So hopefully we'll say the new link or something really. Okay? So don't get confused.
Don't get confused. And don't worry, we'll have somebody at the old link to direct you in case you get lost next month, but we'll get everybody here and on board. So please, everyone, stay safe, take care of each other. Listen to, if you have evacuation orders, please listen to them, get out early, and follow the directions. And we will see you next month. Thank you so much.